I was working at a pet store. It was my job, stocking food. And I heard a pop one night, and I was in a lot of pain. And I went a few days and couldn't move my elbow, so I ended up going to the hospital. They said nothing's broken, just tennis elbow, epicondylitis, lateral epicondylitis. And so they said, oh, just physical therapy, it'll be fine. That didn't work. I ended up having to go through therapy and then surgery for it. And then after surgery, my arm wasn't feeling better, and I was seeing the doctor, the orthopedic, and she said, everything's fine, should be no problem with your arm. And something just never felt right. And after I was done seeing her and she said, there's nothing more I could do, I was still in pain. And my regular doctor said, go see a pain management specialist. So I came here. Within minutes, I was diagnosed with CRPS level 2, and they immediately started coming up with a plan of treatment. And so we've been treating that for several years, and I was still having pain in the joint. And he said, there's this new procedure called a PRP, let's give it a try. And so I said, I'll do anything that you suggest. It was the scar tissue from the surgery that was causing the pain. Extensive pain other than the nerve damage from the initial injury. It's like 100%.
Wow.
I mean, it's unbelievable. I can use my arm. I could trust my arm more in a little bit. Before, you'd go to move it and you'd have this pain in it. You just drop anything you had in your arm. In my hands, and I don't do that anymore. It's unbelievable. I love these guys. I mean, they've literally given me a life back, because until you've been through extreme chronic pain, that feeling like every time you go to the doctor, you're just seeking meds. You know, you're not really there in pain. And to come in here and somebody instantly believed me after 5 years of not having anybody believe that what I felt was real pain, they instantly believed me, gave me a diagnosis which I couldn't get anywhere else. And here's a treatment.
So while working in Cook County Hospital as an anesthesiologist, I realized that the type of training Cook County have given me and the type of patients I'm treating, they have unmet needs. And when we started working with these patients one-to-one, every patient I saw has different needs. And that made me think that we can actually do more for patients than actually what we learned in the medical schools and what we learned during our training. Training prepares us to go and handle the patient and emergencies and crisis situation, but it does not teach us how to get involved in the patient care, what patient needs are, what patient really is looking from you. If you can make a difference in the quality of life of this patient, that's all what they need. And that's what I learned in county, and the county experience was great.
I've been here since day one. Practice opened back in 2002, and I've been with them ever since. I think it's more or less it's just coming here and having a relaxed working atmosphere, and it's just your second home basically. We pretty much all just kind of get along. Our physician relationship as well. You know, we're just all just one big happy family. Knowing that this patient's in good hands, and you know their purpose of having a good result and having a good outcome.
I had issues with my lower back, with my left knee and my right shoulder. And I had seen neurologists from downtown, both Northwestern and Russ. Everyone operated on all parts of my body because I had a lot of deterioration. And at that time I was like 64, 65 years old. Now I'm now 68. And I decided, at this escalating age, why chance that? So I heard about Dr. Anwar through some people I met on a golf course, as a matter of fact, in New Buffalo. And I came and I saw him, and I liked what he had to say. So we began treatment. And I felt better within months. And when we started the PRP specifically in the shoulder and knee, I saw immediate improvement. Yeah, and now I'm back to playing golf, and I'm pain-free, and I feel like a kid again.
Well, the passion for regenerative medicine was to heal the patient and restore the patient's health with his abilities to treat himself with his own body tissues. The healing effects are amazing. These patients have seen the good outcome, their ability to do activities and their daily activities and the lifestyle has changed. Purpose of our therapies is to make the quality of the patient's life a little better than what they are before and avoid them for invasive surgeries, and that's what we're able to do over the years, and that's what we're doing now in this last 2-3 years. We've seen